pathophysiology based on the oligohydramnios. Is it clear? You have the pathophysiology based on the prematurity. Is it clear? Pathophysiology based on the prematurity. So what are the investigation? In order to visualize if the child is having an intrauterine growth restriction, you need to do ultrasounds with the fetal geometry measurements. Is it clear? Fetal geometry measurements, like the measurements of the abdominal circumference, the biparietal diameter, the femoral length, and all those, in order to measure the weight of the child, such as to know if it is corresponding with the gestational age. You need to know that intrauterine growth restriction is when you have a fetus intrauterine that is having a weight which is less than the 10 percentiles of the weight of the same gestational age. Is it clear? So that is for the intrauterine growth restriction. Now, still based on the prematurity, the second element that you can have is also lung immaturity. Is it clear? Lung immaturity, that the lungs is not yet mature. So now the lung immaturity can be supported. To support the lung immaturity, you can use the Bulbo shake test. Is it clear? The Bulbo shake test. And with the Bulbo shake test, what do you use? You need to know that for the Bulbo big shake test, you need to know that you take the amniotic fluid at the level of the posterior amniotic sac. Take amniotic fluid at the level of the posterior vaginal fornix, and then you add it with methylene. Is it clear? After adding with methylene, what you do is that you shake it. Is it clear? You shake the amniotic fluid. When you shake it like that, you are now going to visualize that there are bubbles. If there are bubbles formation, it's going to be a positive Bulbo shake test, and that's actually showing you that the patient is having immature lungs. Else, if the patient do not have a positive Bulbo shake test, it means that the lungs is going to be immature. Now, the other element which can confirm you that the patient is actually having the lung, there's a lung maturity, we need to do the second element for that. We need to do a lecithin sphingomyelin ratio. Is it clear? A lecithin sphingomyelin ratio, and there's a particular ratio at which this lecithin sphingomyelin has to be in order for you to see that there is actually maturity of the lung, or there is immaturity of the lungs. Is it clear? So those are the different elements that you do in order to confirm the different investigation. Now the next one is for the infection. Based on the portal of entry complication, we have infection that can occur to the mother. Now for infections, for the point of focus of the infection, to visualize for point of focus, we can do the amniotic fluid, we can do a high vaginal swab. We do a high vaginal swab and culture. Is it clear? High vaginal swab and culture in order to know the point of focus of the infections. Is it clear? Do a high vaginal swab and culture to know the etiology of the infection. Now for the systemic spread, to know if there is a systemic spread, how do you investigate for the systemic spread of the infection? You ask for the full blood count, you ask for the CRP, and you can also do hemoculture, provided that the patient does not have a significance in the high vaginal swab and the culture. Is it clear? You can even start with first microscopy before going culture, because there are also indications for culture. Generally, culture is expensive and it takes days to come out. So before you get culturing a specimen, you must start by having indications to that. And generally, the indication for culture is that you should have at least 3 days of empiric antibiotic therapy without any improvement of the symptoms. Is it clear? If you have at least 3 days of empiric antibiotic therapy without any improvement of the symptoms, it means that the patient is going to have needs a culture and sensitivity of either the point of focus or the blood. Is it clear? So those are the different elements as for infection. Now the next one is for preterm labor. Is it clear? If the patient is having a complication of preterm labor, how do we evaluate that the patient has preterm labor? Generally, labor is a clinical diagnosis. Is it clear? You can visualize labor by saying increased uterine contractions. If you have increased uterine contraction characterized by the power, which is a good intensity, you are going to have a good frequency, that is 3 to 5 episodes every 10 minutes, or you have a good duration, that is every 4 to 60 seconds. All that can tell you that there is a preterm labor. Is it clear? Now, the second clinical element of preterm labor is going to be the cervix. Is it clear? The second element of the preterm labor is going to be cervix, and in this case, there is going to be cervical changes such as cervical dilatation, cervical effacement, and the consistency of the cervix is going to change to succinate cervix. So all that can help you to know that there's preterm labor. But generally, you can easily say that the patient is in preterm labor when the patient has a cervical dilatation of approximately 4 centimeters dilated. If you have a patient that has cervical dilatation of greater than or equals to 4 centimeters dilated, even if the patient does not have uterine contraction, you already consider to be preterm labor. Is it clear? So generally, there is no investigation for preterm labor. The only thing that you have to do is clinical, and clinically you do palpation of the abdomen to evaluate for the uterine contractions. That's the power, and then you do a genital vaginal examination to evaluate for the cervical ripening, so the cervical changes such as the cervical dilatation, effacement with the consistency and the positioning. Is it clear? So those are all the elements we can tell you if the patient is in labor or not. Is it clear? Now, after investigating, we now go to the management. Is it clear?